The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome back to the Healthy Image Podcast, where we bring you real conversations with the physicians, specialists, and healthcare leaders who are making a difference through early detection, advanced imaging, and patient-centered care. Today's episode shines a light on a condition often called the silent disease, liver disease. From fatty liver to hepatitis to liver cancer, many patients don't experience symptoms until the disease has already progressed. That's why education, screening, and imaging plays such a critical role in saving lives. Joining us today is Dr. Edward Mena, board-certified hepatologist and medical director of Pasadena Liver Center. We'll be talking about his journey into hepatology, the rise in chronic liver disease, the importance of community outreach and prevention, and how radiology and surveillance imaging are transforming the way we detect and manage liver conditions earlier than ever before. So let's get into the conversation. Welcome, Dr. Mena.
Thank you for the invite.
We're really excited that you were able to join us today and kind of explain this a little bit more to our listeners, our patients mostly, who have questions in this area or maybe are being referred to a hepatologist, just to kind of clear up any misconceptions or confusions.
Okay.
Or even for like internal medicine doctors who are not sure, who to send to. Maybe they can send to you after hearing this episode.
Yeah.
Let's hope so.
Yeah. So what first inspired you to join the medical field and specifically be a hepatologist?
You know, I always wanted to be in the medical field, and I think when I was at UCLA in undergrad, I did a lot of research, and research in sciences really triggered my passion and my wanting to be a physician and a researcher. And it's really from understanding basic science and clinical research that really sparked my areas of interest into medicine.
And was there something specific that drew you to working with complex and chronic liver disease specifically?
Yeah, when I was in medical school, I went to USC School of Medicine, and I was really blessed by being trained and guided by two pioneers in liver disease who were Pete Reynolds and Al Redeker. And they were just what we used to call them the godfathers of liver disease. And they studied the liver since the 1950s and on. And it was through their basic research that really sparked my interest into liver disease. And I think what was really neat in liver disease is that we were just really beginning to learn the novelties of the liver, what it does, what its functions, what diseases affect the liver. And to give you an example that I like to teach my residents about, when I was in medical school, we were barely learning about hepatitis C, the type of virus hepatitis C was. And it was difficult to find not only what it did, how it affected people, how it caused cirrhosis and liver cancer, but what would be the treatment for it. And at the time when I was in medical school at the late 1990s, there was really no good treatment for hepatitis C until they developed a bad drug called interferon. And then they developed a few other drugs, and it was through 30 years of clinical trials and drug development that we were able to find a cure. So from going to zero to now being able to eradicate the disease and the virus in simple treatments of 1 pill a day for 12 weeks or 3 pills a day for 8 weeks with almost no side effects and almost 100% cure rate, it was revolutionary. But it was through understanding and doing research and clinical trials that we were able to come up with those data.
And for your office specifically, what does patient-centered care mean to you?
So being Latino, I always like to treat my patients as if they were my family. Like to see, when I see a patient across the room, I'll think, this is my brother, this is my sister, this is my aunt, this is my mother. So we want to give that feeling when you walk into the office. And we also have a saying in my office, the buck starts with us. So we like to treat liver disease from the very beginning to the very end, whether that be end of life care or a liver transplant. So we do or like to take care or have ownership of the entire liver disease from beginning to end.
Yeah. And how is serving as president and CEO of California Liver Research Institute expand your work beyond clinical care?
Mm. So one of the things that really inspires me from a young age, and I give the example when I was at UCLA doing research, I love doing research.
Yeah.
And I love doing research as it involves our community.
Mm.
So one of the diseases that is affecting our community more than any other disease is fatty liver.
Mm.
So when I ask patients, what is the number one cause of liver disease for you or in the United States?
Mm-hmm.
Everybody always asks me, oh, Dr. Mena, it's alcohol, of course. And I say, oh, not anymore.
Mm.
The number one cause of liver disease is fatty liver.
Mm.
And fatty liver is a component of nowadays the metabolic syndrome, meaning obesity, diabetes, hypertension, bad cholesterol. It is these factors that affect the liver that now patients go on to develop cirrhosis
Mm-hmm.
and liver cancer.
Yeah.
So, we were looking at some of the pictures here earlier about heart disease. And we think about heart disease as, it affects patients who have obesity, diabetes. And it's so funny how the heart and the liver are married together.
Right. I never thought about it that way, but that's so true.
So if you can get heart disease from the same mechanisms, you're going to get liver disease
Right.
by the same mechanisms. But it's my organ that's the one that's always forgotten. Everybody always remembers the heart. Oh, yeah, I had a heart attack, blah, 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 blah. And then everybody always remembers the kidneys, blah, blah, blah. But then everybody always forgets the liver.
The liver.
And what does that mean? It means that when I see patients and they come to my office and I tell them, you now have cirrhosis, they look at me and go, that's impossible, Dr. Mena. How could I have cirrhosis? I've never had a drink in my life.
Mm-hmm.
But we forget about fatty liver.
Mm-hmm.
And that's why I call fatty liver the silent killer.
Mm.
And is that, just from what you're saying, a lot of that it has to do with our diets?
100% has to do with our diets, lifestyle. We have a very processed, I'm going to call it soda-rich diet, that everybody loves their sodas and fast food. And unfortunately, fast food is very inexpensive and accessible. And instead of planning our meals like we should do, it's much more easy to look on your phone.
Not cheaper anymore, but it is convenient.
Convenient, and all of a sudden you're ordering McDonald's or other things on your phone because it's easy and it's quick and it's accessible.
Right.
And I think that's what's really, really killing our society today.
Yeah.
Well, as you mentioned, people in their diets and just having easy access to food, and then that being a silent killer. Do you see that with people who do stick with their diets? Do you see people coming in with any liver problems with people who are consistent with their diets as well?
Meaning consistent with their diets and bad things?
No, consistent in the sense of they are doing the healthier choices. Maybe they're doing, I don't know, they're meal prepping maybe.
Right.
They're working out. Do you have healthy people come see you?
So I'm going to answer that a couple ways.
Okay.
Number one, you can get lean fatty liver.
Mm-hmm.
And there is a genetic predisposition to fatty liver. And one of the topics we talked about earlier is what drives my passion to liver disease or research is that every day we learn more and more and more. And one of the things that we talk about is typically Latinos get fatty liver and cirrhosis more than any other ethnic group. And it's because we're eating more McDonald's, eating more tortillas,
I think
having
it's the
more
refried
sodas.
beans.
Is it the refried beans?
It's hard being Hispanic. The food is just so good.
So good, I agree. But one of the things we learned is that there's a genetic predisposition to this. And this gene is called PNPLA3. And that gene predisposes, or Latino patients have that gene more than other ethnic groups. So we are predisposed more to fatty liver and more so to cirrhosis. So you can't get the combination of the bad diet and blah, blah, blah. But you also can get, like you were saying, there's a population that eats correctly and they still get fatty liver, and it's that genetic predisposition.
Can fatty liver be reversed?
So that's what I love about liver disease more than anything else. Because, these heart guys, it's hard to reverse the heart.
Yeah.
The lung guys, they're hard to reverse the lungs.
Uh-huh.
But guess what? I can have reversibility of
Oh.
disease. And a lot of the clinical trials that we are involved are looking at reversing the liver. And one of the areas of most interest is that of cirrhosis. Because when you're hearing the word cirrhosis, or our listeners are hearing to the word cirrhosis, they're thinking, oh my God, I passed that point of no return. There may be a certain point that, yes, may be the point of no return, but what we're learning more is that you can actually have reversibility of disease. So having cirrhosis is not a death sentence. We can actually, and are looking at drugs that reverse cirrhosis and reverse liver disease. So from a research side, this is one of the most exciting times for us because we are looking at revolutionary drugs that can change our disease outcome. That when we would have to have that conversation about liver transplant, we're hoping to put us liver transplant people out of business, that we don't need it anymore if we have the right drugs and we catch it early enough.
Right.
When you say early enough, like how early are we talking about? I do know someone who he was a World War II vet. He had like Hep B. He had a liver transplant. He's no longer with us, unfortunately, but I don't know when he was diagnosed, but I remember everything going downhill as soon as he got the liver transplant.
Right. So I want to talk about Hep B a little bit because today is Chinese Lunar New Year.
Yes.
And hepatitis B, when we talk about communities, it affects the Asian community a little bit more than other communities.
Yes.
And we talk about when to catch it early enough. And what we teach our patients and what we teach physicians about hepatitis B is we like to screen our patients every 6 to 8 months.
Oh.
So when you're given that diagnosis of hepatitis B, we don't like to call it, the silent this or immune tolerant that. We say you have hepatitis B, whether active or inactive, and we want to continue surveillance with blood tests and an ultrasound every 6 to 8 months. So one of the things that I like to do is partner with other physicians in the community. And here's where I love to bring, and I'm going to throw in a plug for our friends at Hill Imaging because they do such a great job for me. And they do the ultrasound on our hepatitis B patients, or they do the ultrasound on our cirrhotics, same thing. We want to do surveillance every 6 to 8 months to, if God forbid they ever get liver cancer, we get to catch it early and act on it quickly. So one of the things we always partner with our radiology friends and our radiology friends at Hill is to be looking for, hey, if there's a little subtle change, please let me know. And you know what? These guys are great. And the great thing about today is they shoot me a text or a call. Ed, I saw something on the ultrasound.
Yeah.
Let's do something about it. And then we take it to the next step.
What are symptoms of a liver issue?
One of the problems with the liver, it's a very resilient organ.
Yeah.
So you may not get certain symptoms until it's very advanced disease. So some of the symptoms you get are jaundice or yellowing of the eyes, ascites, which is fluid in the belly. You can get mental confusion because the liver is the filter that filters out these toxins. So if you can't filter out these toxins, you get the buildup of something called ammonia, and it can cause mental confusion. It can cause mental confusion. So those are late symptoms. But like we talked about today, we want to do prevention. So the best way to check your liver is to go see your primary care doctor and get that liver panel and also get that ultrasound so we can look at the anatomy of the liver, make sure the anatomy is great, there's no blockages, and also look for if there's any fat.
So you mentioned a little bit about hepatitis B and C. Who should be screened for those?
So I think if you look at the U.S. Prevention Task Force, all adults should be screened for hepatitis B and C. But the typical ways that you get hepatitis C is usually transmitted blood to blood. So patients who have ever experimented with intravenous drugs, who have ever had a blood transfusion, especially prior to 1992. Now today's blood bank is very well screened for hepatitis C. Anybody who's had a tattoo, especially done at home, at a parlor, or in prison, should be screened for hepatitis C. But the key thing about hepatitis C is if you do get hepatitis C and you are screened for it early, the treatment is so easy. We have a 99% 98% cure rate. Again, treatment can be 8 to 12 weeks and almost no side effects. So the benefit of you being treated for hepatitis C is really easy, excuse me. With respect to hepatitis B is a little different virus. It's a lot harder to eradicate. So hepatitis C, we can eradicate it. Hepatitis B, you can't, because it's a DNA virus and it really integrates into your own host genome. So it's tough to eradicate. There's a lot of clinical trials looking at drug eradication of hepatitis B, but it's still not there yet. So the medications that we have for hepatitis B, which are great, are really meant to suppress the virus and decrease viral activity. Now, who can typically get hepatitis B? Well, it is sexually transmitted, and in especially third world countries, it's usually the mother who can pass on the hepatitis B virus to the baby. We've eradicated the hepatitis B virus in the United States through vaccinations.
Are there certain cultures or ethnicities who are more prone to liver issues, whether it's, hepatitis, cirrhosis, anything like that?
So I think when we talk about being more prone to liver issues, it's more of a prevalence thing. So like we talked about, hepatitis B is found more in the Asian and African American communities or African communities. With respect to cirrhosis, and I really truly believe that Latinos have more cirrhosis because of fatty liver, because of that genetic predisposition. So I think that makes our cultures a little bit more prone to having fatty liver, which means that we need to be seeing the doctor a little bit more often. And if we do have any evidence of fatty liver, we need to find if they have any evidence of fibrosis. And I'm glad you brought up that topic, because it's not only screening through a blood test, but when I was younger, meaning in medical school and in residency, the way we would determine how extensive the patient's liver disease was through liver biopsy. And if I had a room full of 100 patients in here and I asked who wants to have a liver biopsy, I can guarantee you nobody would raise up their hand. So I'll ask you two girls, do you want a liver biopsy?
You're asking the wrong people, because I would say, if it's going to catch something, yes.
And we're women, so like we're probably gonna do it.
And we're in the medical field,
Yeah,
so
so
we know.
we've
I'm
seen
like,
things, we've
biopsy
heard
me,
of
whatever.
Whatever you need.
I'm like, you can do it all. I'll bring my boyfriend too.
We'll all get a liver biopsy.
Yes.
But, because of research, technology has changed. And we have this special tool called transient elastography, or the simple name for it is called FibroScan. And FibroScan is a pretty cool device, because I just put this little probe over the liver. The computer reads your liver, and without the need of an invasive procedure,
Oh, nice.
within 5 minutes, I know how much fat you have in the liver, and I know what the stage of disease. So I can tell, is your liver no fibrosis, fibrosis, or cirrhosis.
Do you do that in office?
We do that in office.
That's cool.
That's awesome.
It has changed everything.
Yeah.
So one of the things that I also am passionate to do is taking it to the streets and going to the communities. So we like to do health fairs, and we bring our FibroScan. The FibroScan is a portable machine. Think of it as like a little mini ultrasound.
Yeah.
And we can take the FibroScan to you. As long as you've been fasting for 3 hours, we put the probe over the liver, and we can screen about 100 patients in about 3 hours, and we can able to gauge the stage and severity of their liver disease.
That's amazing.
So it has changed liver disease, and that's why I think now we're having a little bit more awareness. I still think these cardiologists do a better job than us, so we got to beat these cardiologists. But with this technology, we're getting better and better and better at diagnosing liver disease.
That's really amazing to think about. Like, how often do you guys do health fairs then?
So we do a health fair at least once a month.
Okay. In office?
No. We go to certain communities.
Okay.
So one of the we always like to go to underserved communities. So we go to Clínica Romero in downtown. We go to the Arroyo Vista in Highland Park, and also remind everybody we're doing a liver walk in Pasadena.
Oh, wow.
I believe the date is April 18th.
Oh, that's
but I'll
fun.
double check on it. So I invite everybody to come, and
Yes.
we walk around Pasadena for a mile or so to increase our awareness on liver disease.
Oh, I love that.
That's really cool.
Are there certain lifestyle habits that can help prevent liver disease?
We want to. It's funny when you're asking me about Dr. Mena. You got to do a funny dance with us. I was thinking, well, how much alcohol do I need to do this funny dance? And alcohol is one simple topic that we don't like to recommend alcohol daily.
Yes.
But, typically 2 glasses of red wine, I think, is a good thing.
Sometimes we
When you
need a
say
little liquid
glasses,
courage.
Sometimes we need a little liquid courage to do that dancing. So it's very simple, Dr. I mean, it's only a few dances. Whoa, that was way complicated.
We need to get you 2 8-ounce glasses of wine, and then maybe we can talk. You
So,
like reds?
I love reds. So I like the lifestyle habit. I always think it's really important is for us. I say decrease the NFL diet.
What is the NFL diet?
Everything you'd eat on NFL Sundays: burgers, fries, pizza, buffalo wings,
Oh,
nachos.
man.
I don't eat any of that.
Me neither. Ever. Never.
Never ever.
I was meal prepping.
Me too. I was meal prepping. No beer for me on Super Bowl Sunday ever.
So I think that's the diet, and we also want to do some type of cardiovascular activity. And you know what I think the best cardiovascular activity is?
Walking
Walking.
for everyone because it's easy. Everyone can do it. 15 minutes after a meal is all you really need.
100%. And when we talk about exercise, we also got to remember our different age groups. And not all of us are going to be going to the gym, running 3 miles and blah, blah, blah. But especially our seniors, walking is the best exercise. And I always like to recommend 30 minutes 3 times a week. And especially for like your mother or your father who says, they become like a little couch potato. You know what? You can walk with me. You can walk 30 minutes.
When is imaging typically the first step in detecting liver disease?
So we always like to start off with an ultrasound.
Okay.
And an ultrasound is crucial as a surveillance tool for us. So when we talk about patients who have hepatitis B or we talk about patients who have cirrhosis, we like to do an ultrasound at least every 6 to 8 months as surveillance for liver cancer. However, when we find something bad, and this is where we really need to partner well with our radiology group. Because what makes the liver unique, it has a very unique blood supply. We have an arterial phase, we have a portal phase, and then we have a venous, and we call that an equilibrium phase. So when I asked my radiology colleagues, and this is one of the great things that we did with Hill Imaging, we made a protocol specifically designed and time the liver correctly. So when I asked my friends to do a 4-phase CT scan or to do a liver-directed MRI, we make sure we time that appropriately so we are able to detect liver cancer and detect it appropriately at the correct segments of the liver. And I will say this, because we were joking around liver biopsies earlier. We really decrease the number of liver biopsies we do when we see patients with liver cancer. And why do we do that? Or why have we decreased that? Because our MRI technology has gotten so good that we make the diagnosis of liver cancer by MRI or CT scan. And if you get a good MRI and CT scan, you've made the diagnosis. And we call that a little criteria called LIRADS criteria. 3, 4, and 5, and 5 is diagnostic of liver cancer. So I really stopped biopsying my patients with liver cancer because I can make the diagnosis radiographically.
Less invasive.
Less invasive.
Yeah.
And we talked about our partners with Hill, and one of the nicest things about partnering with Hill is I've never had so much liver cancer in my entire 20-year career than I do now.
Wow.
Part of that reason is because the hepatitis C population, even though we've cured them, has grown a little older. And when we talked about cirrhosis and the reversibility of disease, we can reverse cirrhosis, but we don't take away yet is cancer. So if you do have cirrhosis, you are at risk for cancer. So we always recommend surveillance every 6 to 8 months. And one of the nice things or good things about being an older physician doing this for 20 plus years, that these patients have been with me for so long, and we've been following these protocols that we're able to detect those cancers and treat appropriately. But what I was going back to Hill Imaging and partnering is we've developed a tumor board where we meet every month, and we get the doctors from the community, we get our oncologist, our hepatobiliary surgeons, our liver transplant team from Cedars-Sinai, our imaging from Hill Imaging, and our interventional radiology group. And we meet once a month and we review all these MRIs and CT scans on patients who have liver cancer, and we make a decision, all of us together as one group, on what the next course of action is going to
Oh,
be.
that's good.
Yep.
Communication really does go a long way, right?
know,
And you
it-
have to be able to work together and communicate well.
It's funny because we laugh a little bit about communication because we
Mhm.
think we're really good about it since everybody has a cell phone and should be texting. We have a billion emails.
Yeah.
Yeah.
But I think we're communicating less.
I mean, we
should
literally
be
we
more.
went back to hieroglyphics when you think about it, like emojis, like we're just
Mhm.
sending pictures to each other. Like we're
Mhm.
going backwards here.
I think so.
But it's not just about communicating, it's about comprehending everything.
Mhm.
Because a lot of times you guys are all busy, right? If you
Correct.
guys are only meeting once a month, you guys are getting through a lot of information.
Mhm.
So then sometimes it's just like holding on information until you guys get to talk the next time because things are always changing, right?
And I think though, when let's say as a patient you go see the surgeon's already thinking one way.
They want to cut you up.
Correct. The oncologist already want to start
Yes.
that chemotherapy.
Yeah, they have that treatment plan ready.
Right. And the radiologist saying, well, I'm here saying this, and this. But when you get everybody in the same
Mhm.
room discussing it professionally
Yeah.
and nicely,
Mhm.
you get a really good treatment plan.
Yeah.
All right, Dr. Mena, we have one question that we always ask physicians.
Okay. How
If
quickly can you do that dance?
Dr. Mena's
No.
going to do a TikTok with us later.
If you weren't going to be a physician,
Mm.
if you weren't going to be a physician as a profession,
Mhm.
what would you have done with your life?
That's interesting you asked that. So, because I have all this fun spare time, I also got an MBA.
Mm-hmm.
And if I was not going to be a physician, I would still want to be doing some type of benefit to society. So it would be in drug development, and I would work in R&D and work on the finance side of trying to get the appropriate drugs at the right cost to the patients.
Mhm.
That's
Yeah.
what I would be passionate about.
Yeah.
That's really cool. Like you'll be the guy making the drugs and making
Correct.
sure it's accessible to patients.
Correct.
For a
For a
Reasonable price.
Correct.
I
Correct.
know.
Because sometimes
Hopefully free.
R&D is expensive.
Yeah.
And you do have to pay for that research that involves in the drugs that work and the drugs that do not work. But that part of the world is very interesting. And I will say a little plug for research trials. And, I do so many clinical trials, and it's convincing our patients to do clinical trials. And a lot of times our patients, our Latino patients or Asian patients will say, yo no quiero ser el guinea pig. And I'm like, well, you're not being a guinea pig.
No.
We're really watching you like a
Yeah.
hawk, and we're
Right.
watching you very closely. You sneeze, we write down how big that sneeze was, what time that
hawks
sneeze was,
also like
etc.
guinea pigs, so that might be a bad analogy.
Good point. Good point. Good point. But no, I always try to convince our patients, especially our ethnic patients, because if you don't understand the drug metabolism in our cultures and communities, then how could we recommend it?
And
to
also, I get it's hard, when you're on the side of it where you're having to make these decisions if you want to go clinical trial route and stuff like that. But you're also in a big way helping all those that are going to come after you.
patients? Correct.
And
Correct.
you're not really physically doing anything other than just showing up and
Right.
letting you guys do what you
Right.
need to do.
Correct.
just
You're
recording
helping
the
so many
data.
people.
Great way to describe it.
So for listeners who want to connect or learn more, where can people find you and specifically the Pasadena Liver Center?
So you can look at us up on our website. I think our website has everything you need from our telephone number and address.
I'll post your website
Okay.
in the description.
Okay. And I think we also have an Instagram feed called Pasadena Liver Health.
And if someone has some sort of liver concern or a question regarding their liver, how can they schedule a consultation or get referred to your practice?
So number one, always discuss it with your primary care provider and make sure to come see us, and you get the appropriate referrals to come see us, because for us in liver disease, we want to see every single case of liver disease in Los Angeles. So I think the best way is to communicate either through the website or call the office. Even though I know we get all these phone calls about our phones being inundated, but we will do our best to get.
We
get
know
back
how
to
that
it.
goes.
Yes.
Yes. And what would a patient ask their PCP for if they're having some sort of liver concern?
I think the biggest thing that they need to ask their primary care doctor is, please do a blood test to check my liver.
Okay. And that's just a liver panel.
Correct. And it's a complete metabolic panel, and it has the markers of liver injury, which is your alkaline phosphatase, AST, ALT. if those are abnormal, then you should take the next steps to find out why they are abnormal.
Okay. Well, thank you so much. This has been really fun,
Yeah.
very educational.
Good. I'm glad.
I learned a lot. Now, like I said, I'm going to be nervous every time I'm mentally confused and be like, wait a minute.
Wait, refer back to that episode.
Be bugging my doctor. Thank you for joining us on this episode of the Healthy Image Podcast. Today, we explored the power of early detection, the growing impact of liver disease, and how imaging plays a critical role in diagnosis, treatment planning, and long-term surveillance. A big thank you to Dr. Edward Mena for sharing his expertise, his advocacy work, and his passion for improving access to liver care in our communities. If you found this episode helpful, be sure to subscribe, share it with someone who could benefit, and stay connected with us for more conversations that bring clarity to care through imaging. And as always, stay curious, stay engaged, and stay healthy. Bye.
Bye.